To understand knee arthritis, you need to understand a little bit of anatomy. The knee is made up of three different bones: the femur, which is the thigh bone, the tibia, which is the shin bone, and the patella, which we also know as the kneecap. The ends of each one of these bones, as you can see, is covered with a shiny, cushiony shock absorber called cartilage. The cartilage allows our joints to move smoothly and without much pain. When this cushioning starts to wear away, it can either wear away in one spot or generalized everywhere, we call that arthritis. Generally, arthritis is due to wear and tear, but can be due to a chronic injury, an injury that just happened, or even due to diseases where the body attacks its own joints, such as rheumatoid arthritis. When the cartilage starts to wear away, people will start to experience various symptoms. Usually the first symptom that people experience is stiffness and discomfort or pain with long periods of activity and long walks. Sometimes after getting up in the morning or sitting in a chair for a long period of time, they'll notice that the leg starts to get stiff. Later on, as the arthritis starts to get more severe, people will notice that their motion of their joints becomes decreased, meaning they can't get the knee fully straight. They can't bend their knee fully. And when arthritis starts to get really severe, people will notice that the leg will either start to bow in or bow out, and that's due to preferential wearing out of cartilage or even bone on one side versus the other. Depending on the degree of arthritis, it depends on what the symptoms are, and it depends on what we would do to treat it. Early stage arthritis sometimes is just treated with things like resting, icing, and avoiding activities that tend to bother it, like stairs or walking long distances. When arthritis starts to get a little bit more severe, we start to send people to do physical therapy or even take medications such as anti-inflammatory medications. When those no longer work, there's various different types of injections, from cortisone to even stem cell injections. And then for more severe arthritis, we start talking about things like partial and full knee replacements.